Meanwhile, the World Health Organization believes the hantavirus that broke out on a cruise ship may have been a rare case of human-to-human transmission. So far, 3 people have died in the outbreak, and there are 4 other suspected or confirmed cases of the virus. Now, the cruise ship MV Honduras is now docked off the West African nation of Cape Verde. The 150 passengers on board are not allowed to disembark. The lounge and other public spaces still remain empty. Passengers are confined to their cabins to try to prevent the deadly hantavirus from spreading any further. Now, the ship set sail from Argentina more than 4 weeks ago, promising its 150 passengers a journey to several exotic places, culminating in Antarctica. Now, passengers are stuck on the ship. One of more than a dozen Americans on board that cruise ship sent a tearful message on social media about the plight of stranded passengers.
We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home. There's a lot of uncertainty, and that's the hardest part. All we want right now is to feel safe, to have clarity, and to get home. So if you're seeing coverage about this, just remember that there are real people behind it, and that this isn't something happening somewhere far away. It's happening to us right now.
Health officials are just trying to decide what will happen next with the passengers. If there is a need for a quarantine, it could last as long as 2 months. The incubation period for hantavirus is between 1 and 8 weeks. Now, this outbreak is causing concern about the safety on cruises. Joining us now is cruise expert Stewart Chiron, who was on a cruise when COVID broke out. Stewart, I'm curious, what was the protocol on ships to prevent the spread of a dangerous virus? Is the ventilation shut down? How does it work?
No, the cruises, essentially what they'll do is they have different protocols for different ailments. And, first and foremost, the safety of the passengers, the crew, and the destinations they visit is paramount. And, they operate these ships in a very health efficient, very health conscious manner. And what they'll do is they'll shut down certain things. They may reduce person-to-person interactions. You may not be able to serve yourself at the buffet, for example, while this is being investigated. But there's extreme cleaning that goes on. There's a reason why almost 38 million people are going on a cruise at record numbers in 2026. Despite everything going on in the world, people feel safe, and for good reason, because they can keep these different issues really at minuscule numbers when you look at the grand scheme of the amount of people cruising.
So many of us have a story about what it was like when COVID broke out. And you actually were on a cruise ship during the start of the COVID outbreak. I remember we didn't know what this virus was. We didn't really understand how it spread yet. I'm curious, what protocols at that time did they implement on that ship that you were on?
Well, we were having to, do some self-distancing. They were controlling, like at restaurants, we couldn't, the salt and peppers, the breads. They were reducing those interactions. They were doing everything they could based on the minimal amount of information that they had. People that were ill, there were people that were quarantined. You had ships that, let's say, at the same time that had the usual norovirus, which, people have to understand. There's 685 million cases of norovirus around the world annually, 21 million here just in the U.S. based on the CDC. And, people feel confident and safe in going on a cruise, that as issues arise, that the ships and the management teams ashore as well as on board the ships are going to do everything they can to minimize the experience and the impacts on all of the passengers.
Yeah, you bring up a good point, because this is one of several alarming stories about cruises that we've been hearing about over the past few months. We're entering the busy summer season. A lot of folks taking their vacations, many of them choosing to go on a cruise. What do travelers need to consider before booking one of these cruises?
Well, if they're going this summer, they're already booked, and people are ready to go. And with everything going on in the world, there's more people that are looking to go on the ships because of how confident, especially heading to the Mediterranean, Alaska, Northern Europe, Alaska, the Caribbean. People want to go, but they want to be safe. And one of the main things I could recommend people do is, absolutely take a look at the trip cancellation and interruption insurance to make sure that you have coverages just in case there may be travel delays, baggage delays, but in case you get quarantined or you need to fly home from certain destinations, that insurance is going to really make a difference. But people that go on cruises or that have season cruise, look, I've been on almost 350.
Wow.
And I mean, there's not a place I'd rather be than on a cruise. And I could tell you when COVID, was starting to end, when the cruising restarted, it was to me, it was the safest place to be. And the cruise lines did an incredible job in order to keep us as passengers safe, and also the destinations. And sometimes, they may change itineraries, during the course of the cruise, but they're not doing it just because. They're doing it in order to make sure everybody's safe. And I could tell you, during the restart, I mean, there were destinations we docked at that we didn't even get off at. We did it because of the health advisories. We stuck with what the CDC was recommending, the cruise line's own protocols, but they have to do everything that's going to make the ship safe. And that includes, when they're rescheduling to go to destinations that may be impacted, let's say by foul weather. Could be a tropical storm, it could be a hurricane. They've got to keep those ships and the passengers safe. And again, there's a good reason why, you've got so many millions of people going on a cruise. Because I just think a lot of people are tired of price gouging at hotels.
Stewart Chiron, thank you so much. Great to talk to you.
My pleasure.